Here I am pulling into the agency, into my building. Usually the street is full of parking with my staff, but as you can see, there's lots of empty parking spaces. So actually there's a few cars here. One of the fun things I get to do when I come in to the office is sign donation acknowledgements. And it's amazing to see. I mean, these are stacks of people who are either sewing for us or donating funds to us. And oh my gosh, when I get to come in and see these, it just fills my heart with gratitude. I am so thankful for people who are continuing to support us out in the community. So thank you so much.
Good morning.
I have a present for you.
Your mask. Look at that. Fantastic.
Yeah.
Nice.
So Tiffany is the person who is coordinating all the PPE that the community is sewing for us. I made those masks. I love the Halloween fabric, but I ran out of fabric, and then I dug through my boxes and I found an old shower curtain.
Nice.
So these ones here are made out of shower curtain material, which I think is nylon, which I think is kind of cool.
This will be nice for summer when it's hot.
Yeah, exactly. So, anyways, Tiffany, I don't know, can we get a look inside your office and see what we have?
Well, you can look in here. This
Oh, in
is where
here?
all the masks are.
Oh my gosh, look at that!
Yeah.
Wow, that is excellent.
Those are ready to go to agencies who need assistance.
And what are these?
To staff. These are leggings that were donated.
Oh, sweet, yes. By an employee. Yeah, I know, anonymously. And these are donated, I think, to our aides.
To our aides, anyone who can wear them under their scrubs.
Yeah, that's awesome. So people have been so kind and generous. This is great. So Tiffany says she has a mask for me.
Batman.
Oh, I love it.
Everybody needs a superhero mask.
I love it. It's going to be much better than, oh, I hate to even say it, but this cougar mask. I've had this. Oh, wow. That's a beaut, too. Look at that. I love it. Okay, I'm going to put it on right now. So I have my new Batman mask. It's great. We screen everybody that comes in for temperature. Right? This is Mariah. She's one of our CNAs. We're going to make sure I'm not sick.
Just on your forehead.
That's in the normal range.
It is.
I must be feeling okay.
Yeah.
All right. Well, I will continue on my way. Thanks, Mariah.
Thank you.
I was just in our hospice care center here in Longview, and a couple things happened in there while I was in there. So, first of all, and this really underscores the issue with testing and PPE. So, first of all, we have a patient who developed a fever at home. And we really wanted to get that patient tested, but we don't have the test kits. And so whenever a staff person goes in there, of course they have to wear full PPE. If we had a test where we could get them tested immediately, because apparently the patient's fever is going up and it's going down and it's going up and down. It's probably not coronavirus, but we don't know for sure, so we have to treat everybody in that situation as if they are coronavirus patients, use full PPE and full precautions, including the visitor restrictions and all that. So, but we don't have any tests. The 20 test kits that we were supposed to get are somewhere in a shipping loop, and I can't get an update as to where these tests are. So that was one of the things that happened in there that was somewhat frustrating for the staff. Mary Kay Morelli, our Vice President of Community Relations, we had lunch and we talked about a number of things that are supporting our staff and our patients. Fundraising, most of all, around different grant opportunities.
That's right.
Right?
Yes.
So Healthcare Foundation, Friends of Hospice, Murdoch, other different donation possibilities for obtaining PPE, helping our COVID fund, and then of course we talk a lot about how can we acknowledge donors.
Recognize and appreciate them.
Recognize and appreciate all the people who have helped us and stay in touch and keep them informed. What else did we talk about today?
Oh, we talked about Giving Tuesday.
Giving Tuesday, which is coming up next
which
week.
is a week from tomorrow, and that's another opportunity to support the needs of COVID-19. So
watch for news
watch
on
for that.
watch for that.
Yeah.
The newsletter, which has just gone out, we touched base on that, and that's got an update in that on what's happening at the agency. So Mary Kay gets just I can't believe how much work she gets done every week. I sit down and she's got this big list. You can see the big list. Check. She's got all kinds of stuff that we're working on. But again, it's all to support what's happening right now with patients and families and the whole pandemic and all that. So, okay. That's
Thanks.
it. That's all we got. So we'll see you. Just going out for a bite of lunch after biking into the Heimbigner Center. I wanted to tell you about a conversation I had with one of our home health nurses yesterday. His name is Jacob. And I asked Jacob, what are patients saying out there about this whole virus, coronavirus pandemic, and all the precautions we need to take, and what's it like to have a nurse come to their home? And he said it runs a range. That's what Jacob said. There are people who are really doing well and abiding by the social distancing and understand all the need for all of our precautions and why we're all wearing masks and things like that. He said there are also some other people who think it's all, unnecessary, basically. And I said, so given that range of people that you're visiting in their homes, what do? Do you take time to educate them? Do you just let them be where they are? What do you do? He says, oh, no. It's time to have a conversation about why we're wearing masks, why it's so important. And he said, if we weren't taking all these precautions, I thought this was, such a wise observation. Jacob says, well, if we weren't taking all these precautions, hospitals would be inundated right now with coronavirus patients. They would be inundated. And we don't have enough healthcare beds and resources to go around. But people still who are getting appendicitis and having heart attacks and having strokes, they need access to medical care. And so it's important right now. One of the reasons why we're trying to flatten this curve is so that, not only for the coronavirus patients, but for all these other types of patients that need medical care right now, we have to make sure everyone has access. And that's one of the reasons why it's so important for all of us to be doing our part. And I thought Jacob described that whole situation so succinctly. I just wanted to call that out and say that was a really well-reasoned approach to telling patients why we're doing what we're doing. So good on you, Jacob. Since I recorded that video earlier this week about not knowing where the tests were, well, they actually came. And so we got our 20 test kits from our supplier, and we have done our first coronavirus test on a patient. The problem is when we dropped off the test sample, we were told it was going to be 5 days until we get a result. And so again, it's like starts and stops. It's like good news, bad news. So yes, we got our test kits, but now it's 5 days till we get a result. Well, in hospice, 5 days is the difference between when the patient might be with us and when the patient dies. So that's entirely too long, and we must have access to more prompt testing than that. So that's something I'm going to keep working on, is getting better testing. But I didn't want to make it sound like it was the lab supplier's fault or anything like that. I mean, nationally, you've heard in the news that we need more testing universally. We need more prompt testing, and even in some of those very, very prompt tests, the kinds you can get back in 15 minutes, the reliability of those tests needs to increase. So the tests that you send back to the lab, with the swab and the syringe, the test tube, and those are very reliable. The ones that are drive-through, if it's positive, it's pretty reliable if you get a positive result. But if it's negative, that's where it's like, I think we might need to test again or use a different testing method just to be sure. So we still, again, have a ways to go in terms of our testing capability. So the other thing I wanted to comment on was the fact that we had a lot of masks apparently in those boxes. And one of the things that I'm thinking about is, as states like ours release restrictions, the problem that we had before, we're talking 7-8 weeks ago, was as the virus started, those numbers started growing, we did not have a stockpile of PPE. And that's why we started getting into trouble and kind of panic mode amongst healthcare providers. And I think what we're doing right now is trying to at least create a 3 or 4 week supply of PPE, so that as states start easing their restrictions, if those coronavirus infection numbers start creeping up again, we actually have a stockpile this time. So learn from the past and plan your future. So that's kind of where we are now, is trying to create a different supply mentality than we had before.